Thank you all for joining our program tonight. We will be talking about typical child development with Andrea this evening. Andrea studied communication disorders at the University of Georgia. After graduating, she worked at a school with a 1-to-1 student-teacher ratio for children with complex communication needs. She moved to Savannah, Georgia to complete her master's program in communication sciences and disorders. After graduating, she worked in public schools in Savannah as a speech-language pathologist for 3 years. Andrea is now a speech and language pathologist for an Atlanta-based multidisciplinary clinic that specializes in autism called All Kids First. She also facilitates a support group for adults with autism that meets twice monthly. Andrea, thank you so much for being our presenter today.
Yes, thank you so much for having me. And thank you for joining us for this program. So today, I'll be sharing with you some information about what to look for with your child to make sure they're meeting the milestones as expected. So it's called Child Development and When to Ask for Help. So Ms. Christine did such a great job introducing me already. I did want to add that I helped with the Babies Can't Wait program as a speech therapist in Hinesville, which is close to Savannah, which helped me understand the process in public service, especially from transitioning from Babies Can't Wait to the school service as well. So speech language pathologists, they help with communication difficulties across the lifespan, but very often, people will go to a speech language pathologist if their child is a late talker, or if they have language comprehension issues. I put this one in quotes because sometimes when it seems like they're not comprehending, there might be something else at play. Something like they are not interested in attending, or they're not understanding specific words, or sometimes it's even that the way that the parents are talking is not conducive to the way the child learns. Speech language pathologists can also help with speech sounds, which are different from language. The speech sounds being how your mouth makes the sound, and the language being the words and the meaning of the sentences. Speech language pathologists help with stuttering, voice issues, and also feeding and swallowing. And then on the right, you can see some of the disorders that are common for speech language pathologists to work with, including autism, intellectual disability, and also some head injuries. So when I first started putting together this presentation, I started listing out the developmental milestones for each specific age. But I didn't know who would be attending the program. And the milestones are often broken down by 3-month increments. So I thought it might be better to provide instead these resources so you can find your child's specific age and then look at the milestones broken down by communication and physical and social. So I'll just show you what that looks like here. This is the CDC's website. And you can see, especially in the early ages, it's really broken down into small increments. And then also the American Speech and Hearing Association also provides their own list of milestones. And you can see some of the language milestones for children and ways that you can help. So hopefully that will give you some more specific guidance into the exact milestones. So the first thing that I want to talk about in terms of signs that you might need to ask for more help or might want more information is things about hearing loss. Now, the reason that speech therapists are so interested in hearing loss is because children learn so much from hearing their parents and hearing sounds and being able to localize sounds, where the sounds are coming from. If a child isn't able to hear well, they're not able to hear words well, they're not able to hear sounds well, and they're going to be delayed in that area. Universal hearing screenings usually happen at the hospital. Since 2010, there's been legislation in 43 states that make sure that kids get universally hearing screened, or just have their screening done at the newborn age. But there has been position statements since 2000 of people recommending this as a practice. The thing is, if the child fails, it's up to the parent to make sure that they follow up with the rescreen. And while failing a hearing screening doesn't necessarily mean that there is deafness, even small periods of time, such as when a child has an ear infection, can leave the kid not being able to hear the language that's going around them for that period of time. So hearing loss can also occur after birth, sometimes from bacterial or viral infections, or head trauma if they take a fall. And also, as I mentioned with the ear infections, if your child is getting like a lot of ear infections, this is something that you're really going to want to stay on top of so they're not missing out on the language that's happening while they're sick with the ear infection. So some of the things that you might look out for the hearing loss are they start babbling, but then they stop. So one thing that's kind of interesting is that deaf children often babble, even though they're not hearing anything. They're experimenting with their voice. What happens with the babbling that stops is that usually they're not getting any feedback from it. They're not hearing themselves and it's not exciting for them. So they do stop. Another, red flag would be if they're not responding to their name, if they're not paying attention to music, or if when they hear something, they're not looking or at least moving their eyes toward it. I just wanted to add a later developing one, which is if they're babbling, but the babbling doesn't change. Now, depending on where your child is in the development, sometimes, we're just looking for them to be doing repeated sounds like ba, 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 ba. But after that, we want to hear ba-dee, 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 or ba-ga, ba-ga. And so if your child has been babbling the same sounds for a really long time, that could be a red flag that might warrant a visit to the pediatrician. So here we have a graph of sounds, and basically sounds are broken down into their loudness, that's the decibel, and how high or low they are with the frequency on top. And so what you'll see is like a loud low pitch would be like the garbage truck in the bottom left, and a soft high pitch would be like rustling leaves, which is around the right corner on the top. Speaking voice kind of falls around the middle, except for three sounds: the F sound, the F, S, and the TH sound. And so you'll see even if a child or an adult has a very mild hearing loss, they may be missing these sounds, which are important for grammar. So if you're missing out on the S sound, you're not going to be able to pick up on if mommy's saying, oh, that's mama's. That belongs to mama, it's mama's. Or, they might have difficulty with hearing plurals as like, she bikes and they're biking, so those kind of things can affect language beyond just not being able to hear the sound to be able to produce it on their own. So another thing that speech language pathologists kind of look out for, especially with late talkers, is red flags for autism. So just because a child is a late talker doesn't mean that they are autistic, but sometimes it's the first sign that people notice. One thing that's become sort of a characteristic of autism is that a child will start using specific words and then they will just stop and not use those words anymore. But one good thing is that a lot of those kids do recover the speech, but it is something that's kind of specific to autism. They might develop rituals or have like restricted play. So I know a lot of people are familiar with the lining up objects, but it could also be spinning objects over and over and just doing the same action instead of having a variety of play actions. Imitating is a skill that comes naturally. So if your child is not imitating your actions, if they're not imitating words already, this could be a sign that they have a little bit of difficulty attending to people, or it could be a difficulty with seeing something and then being able to do it with their own bodies. There's also sometimes unusual sensory interests. So they'll be like very excited by like smells, or sometimes kids will like look at the side of the corner of their eye because it brings like an interesting visual sensation. And one of the theories on this is that babies, they're really stimulated by everything in their environment. So something out of the corner of their eye would be really exciting to the baby, but as they start developing, their brain becomes used to some of the things so they can focus on new things. So if your brain gets excited every time you see something from the side of your eye, you're not going to be able to focus on something new in the environment because it'll be too distracting. So what they think is that some people with autism, they didn't really experience that synaptic pruning, meaning that their brain is still firing at a very fast rate at those sensory experiences. And that is one of the reasons why they also think that the language is delayed, mostly because it's so distracting of some of the sensory experiences that they're having. And another red flag for autism is if a child uses your hand to get what they want. So they might like bring you to the refrigerator. But the difference between this and a child just bringing you to what they want is the eye contact. A lot of times a typically developing kid might bring you to what they want, but then, make a sound like, ah, or, point or look to the fridge and back at you. And what we see often with kids with autism is that they're just bringing you to the thing that they need and expecting it to be fixed or be given. So another thing to kind of be monitoring is visual skills. So from a language development perspective, we want our kids to be able to take in the sights and sounds so that they're able to make connections with the words that they're hearing. Also, kids learn so much language from facial expression and mouth movements. And if they're not able to see those things clearly, they're going to have a harder time catching on with the language. Also, as we're raising our babies, we're saying, oh, look at the dog over there, look at the dog. And if they're not able to see past that, they're not going to make that connection between the word dog and the concept of a dog. So visual impairment can be caused by damage to the eye, at birth or after birth. It could be like a neurological difference, something that is just in the brain that's affecting, the transmission of information. The eye could be developing in an odd shape. So these are all kind of causes for, why a kid would have visual impairment. And you might notice that a child with visual impairment will be closing or covering one eye. That's what you see in this far left picture. Squinting or frowning. The baby in the middle is looking at a toy. This is called tracking. So it's a developmental stage where we want the baby to follow the item with their eyes as we move it over from side to side. If the baby's eyes go in different directions after 4 months, that can be a risk factor. It is normal before 4 months. And in the picture of the boy on the third from the left, you can see his eyes are pretty watery. Now, of course, we have to be aware of if he was just crying or not, but if they're constantly watering and it doesn't seem to be related to crying, this could be a sign that there might be a visual impairment. And they might become tired after looking at things far away or looking at a book, eye strain. So that could be another sign for a little kid. So if we're seeing any of these risk factors, we want to go straight to our pediatrician. So the pediatrician is your point of contact, for all services and therapies for your kid. They're going to really understand the developmental stages on a deep level. So it's important that we are going to our regular well visits, not just our sick visits, but our well visits too, because then they'll be able to see things that we might not have caught up on. Also, if your child needs a therapy, such as speech therapy, they often need a prescription from the doctor to be able to get evaluated and get that service. So anytime that you have a concern, your first go-to is your pediatrician. So you might also go to a developmental psychologist. They evaluate for developmental disabilities, like autism, among others. Often the speech and language delays, as I mentioned before, are the first ones that people notice. And the developmental psychologist can help assess if your child, is meeting milestones in like mobility and core strength, whether they're having like early cognitive skill development, like planning and problem solving. The developmental psychologist might give your child like a shape sorter or a puzzle that most kids their age can do, and kind of be looking to make sure those skills are developing as well. And then also the developmental psychologist will be able to make educational recommendations. So if your child is going into school, things to talk to your teacher about that might support them in their learning. We've talked about what a speech language pathologist can do, but they evaluate and determine the cause of communication difficulty. They do weekly therapy sessions, which often include parent training, so that you can keep practicing at home and help your child have the most language opportunities possible. Also, if your child is not yet talking, the speech language pathologist can help you and your family decide on another communication system, like sign language or pictures, that can kind of help in the meantime while we're still working on that verbal speech, but at the same time making sure that they have a way to, communicate their wants and needs. An occupational therapist is someone who helps kiddos. They have a broad range of skills that they work on. So fine motor could be like holding a fork or a crayon or using a zipper. So sensory integration. So some kids, their bodies and brains are sometimes overreacting and sometimes underreacting to their environment. And this might look like a kid who has a meltdown and we don't understand why they're so upset. Or it might look like a child who's always trying to spin because they are seeking out a certain sensory feeling. So the occupational therapist can help figure out what your child is seeking, why they're doing the certain things that they're doing, and how we can provide that sensation for them so we can clear out space for them to learn new things. Because as we talked about before, these sensory experiences are sometimes take up your whole brain and attention. So the occupational therapist can kind of help find activities that will help calm the body and brain down. And adaptive self-help skills are like bathing, grooming. It could be like remembering the steps to washing your hands. And then also they might work on safety as well. And feeding. So it could be even all the way to, breastfeeding. Making sure they have a good latch, but then it can also be trying new foods and making sure that they're able to move the food from the sides of their cheek, into their throat. They help with that. So a physical therapist, they have the best knowledge of the, gross motor milestones. So like sitting up, crawling, reaching for things. They might help if your child becomes like unsteady and can't grab their balance. And also they help with muscle tone. Applied behavior analysis therapy, this is called ABA therapy. It has the most evidence base for children with autism, but it can be used by other, kids who have developmental disabilities. Or it can also be used by, children who have just like attention difficulties as well. So some of the skills that they might work on in ABA therapy are like self-help, school readiness, social skills, visual spatial skills like matching. Sometimes they do functional communication. They also specialize in reducing problem behaviors. So if a child has, developed a behavior that's maladaptive to get their needs met, they can help retrain it and find a better replacement behavior. So this picture is kind of an example of how ABA therapists break down large skills into smaller skills. They're also using a visual, which is something that's used by a lot of disciplines, including speech. But something that's so simple like hand washing can actually be broken down into 6 discrete steps. And so what an ABA therapist might do is do the first 5 and then have the child do the 6th. Or the child can do the first step and then, the therapist will take over until they can do it completely independently. So I wanted to provide some strategies in case you were feeling like you're seeing some red flags of things you can already do at home while you're waiting to get to the doctor, or if you've already been to the doctor while you're waiting for an appointment. So the first thing is be a sportscaster. So for kids who are a little delayed in language, just talking about everything that you're doing is a really good, easy strategy to build more language into the day. So it's a little unnatural for adults because we don't do this all the time, but it looks like this. Oh, I'm picking up my water. I'm going to drink some. That was so good. I love water. I'm going to put my cup down. So just having this kind of chatter all day really helps your kid kind of have words for the things they're seeing regularly, and you don't have to do anything extra like play with a specific toy or sit down and do a specific strategy. It helps to just talk about what you're doing. So, a common problem that I see with kids who are delayed talkers is, we don't want to see our kids struggle. And so a lot of parents, they get really in tune with their kids and they know exactly what they need, before a child even does anything, before even child cries or starts looking around. And so a good habit to get into is stop mind reading. We want to get them in practice for adults who may not be in tune with them as the parents are. And this provides some space and opportunity for them to try something new. When a child is getting everything they need without gesturing, without vocalizing, making a sound, without trying it themselves, that doesn't create an opportunity for them to try. And when there's just space, when there's just wait time, sometimes our kids surprise us in what they already know how to do or can do if they're given the opportunity to try. So just a little wait time, just a little, oh, I don't know. Can you help me? I don't understand. Make it your problem, not theirs. This is a really good tactic. Daycare / pre-K is so wonderful for kiddos, especially who are language delayed. The reason is, number one, a language-rich environment. So pre-K and daycare, it's a place for kids. Everything about it is about kids. So they're really motivated, to engage with the environment. Sometimes a child might, not be so tuned into mom cooking or, mom putting away laundry, but the whole day of pre-K and daycare is around kids' activities. So they're really tuned in and they're hearing the language from the teachers. Another great thing is that they're around similar age peers. And sometimes this is just the little push that they need to see a kiddo who's their same, age. They can see they're the same size. Doing a certain thing could be really motivating for them to try it. A play action or even a talking action, because kids can be really motivated by their peers, as well as getting a really early start on social skills, because as we know, they'll eventually go to school. And if they've had some practice with this already, especially like with a lot of kids, and I mean, play dates are great, but the opportunity to be with a lot of different kids, doing a structured activity can really, really help them transition into school. I also wanted to mention that if you get your child evaluated by the school district because you suspect that they have a disability, they can start pre-K early as part of like an early intervention program. So if the school psychologist, decides that they're delayed substantially in some of the developmental areas, it could be communication, it could be social, it could be motor movement, and they qualify, then they can go to pre-K at age 3 for free. And speech is also available at that age, but it is not for the full day of pre-K. But if your child doesn't meet the specific criteria, regular daycare would be just the same, because it can be a little bit strict in terms of need. So your child would have to meet eligibility, meaning that they would have to be below a certain criteria. So the last thing I wanted to mention is that previously there was a wait and see approach, but that's not really recommended anymore because the ages between 2 and 5 are considered a critical language period. So the brain is, developing super quickly. It's like at its most moldable between these ages. So if you find yourself being met, with someone who's saying, let's wait and see, and you really feel that there are some concerns beyond just a little bit of a delay, I would recommend getting a second opinion, because wait and see is not really the standard anymore. They feel that early intervention can't hurt, even if they are going to get it eventually themselves, nothing bad will happen to them from getting support. Whereas if they don't get the support, we're losing that time of neuroplasticity of our brain being so able to take on new information, that it's best, to start early. Children can still make progress towards goals past age 5, but we really see the biggest gains for kids who are participating in early intervention from 2 to 5. There is just one more resource that I wanted to show you all before I go to take questions, which is the MChat. Now the MChat is an online screening tool for autism, and it can kind of just give you an idea of whether your concerns, are severe enough to talk to the pediatrician. And if you do talk to the pediatrician, have exactly, the checklist items that you want to talk about. It kind of gives you some talking points. So let me share that here. So it's on the Autism Speaks website. It's called the MChat R, and it takes about 5 minutes to complete. So the last thing that I wanted to share is just my contact information. I am with All Kids First, which has clinics in Snellville and Berkeley Lake. But if you have anything that you want to talk about, maybe you're not comfortable talking about in this meeting, please feel free to email me. I can answer questions through email. And we also offer, screenings and evaluations if that's something that you're interested in.
Okay.
So I'll turn it over to Christine now.
Okay, great. Thank you, Andrea. Well, first of all, thank you so much for all that information. I think that's, really helpful, because a lot of times as parents, we really don't have the full awareness of all the different specialists that can help us with our children. So I appreciate you going through, and explaining some of the milestones and all the different people who can help. I did also want to remind our attendees that we do offer many free resources from parents, for parents as well. You can check out our website for more information about upcoming events. And also wanted to point out, it's our summer reading challenge this year. So if you are local and want to sign your children up for that, that would be great. And, again, thank you for spending the time to attend tonight's program. With that, I'm going to turn it back over to Andrea so that she can answer some more questions from folks if you have them. And I'm also going to go ahead and unmute, and I will stop the recording for privacy purposes.